Hi everyone, I'm Sophie. I'm the head of comms and campaigns at Nottingham Women's Centre. I've been asked to come along today to talk to you all a little bit about turning practice into policy and how our external relations team here at the Women's Centre works to transform direct practice into policy and campaigning work. A little bit about me. I look after the external relations team at Nottingham Women's Centre, and most of this work is actually done by our policy and influencing officer. So we've recently hired a new person in this post, Ezenwani, who's actually here with us today. But as she's not been here very long, I thought it'd be a bit of a baptism of fire to ask her to present. So today I'll be the one talking to you about our work around this. So I thought I'd kick off with a little bit about Nottingham Women's Centre for anyone who's not familiar with what we do. We're actually one of the oldest women's centres in the country. We've been around for over 50 years. So we were established in 1971, basically in someone's living room. And that was all during the second wave feminist movement. And I think it's this basis in campaigning really that's run through all of our work ever since. So back in the 70s, women were demanding equal pay, education and job opportunities, access to contraception, access to an end to homophobic discrimination. They were campaigning against violence against women. And the centre was basically a space for everyone to hash out those demands. And 50 years on, unfortunately, we're still fighting a lot of the same battles, but obviously we have also come a long way. And since then, we've basically adapted with the times and with the funding as well, to be able to offer a variety of services for women in Nottingham. So what we offer now, we have a range of services really for women experiencing a variety of challenges. So whether that's domestic abuse, mental health struggles, being in the criminal justice system, financial difficulties, that sort of thing. We offer one-to-one casework support to women with all of those things, as well as counselling and guided signposting to other specialist organisations if we're not able to help with certain issues. We're kind of a one-stop shop for women, really. If someone comes to us and we don't offer a particular service that can support them, we can usually get them to another organisation that does. And our building's also home to Juno Women's Aid and Not Sexual Violence Support Services. But we're not just for women in crisis, and that can be a little bit of a misconception with us. We're also just a safe space for any self-identifying woman to come along and feel comfortable. We have a welcome space, like a little kitchen where you can come and make yourself a cup of tea or coffee and relax. We have a women's library, and we have a load of kind of courses, activities and events and things like that that you definitely don't need to be in crisis to be able to use and enjoy. And then of course there's a lobby and activism side of things, which is what I'll be talking more about today. So I think it's this like real mixture of provision that attracts such a huge variety of women to the centre, and that's what puts us in a really good position to do policy and influencing work to make changes on a wider level, because we work so closely with such a range of women. You know, we're not just specialists in one particular area. We're like well positioned to be able to kind of identify some of the more overarching issues that are affecting women locally, and that's a really important strand of our work, because although it's vital for us to provide support services for women directly in crisis, it's also key to understand what some of the root causes are and look at how we could potentially influence change on a wider level, or even just organisationally as well. So this work sits with our policy and influencing officer, and I thought I'd talk a little bit about this role so that you can kind of understand what they do and how they slot into the wider organisation, because I know that this is a post that a lot of organisations our size just don't have, but I think it's something that if you can get the funding for, it's a really valuable post that can make a real difference to the organisation and to the wider community as well. So this here is kind of like an overview of the role, and it hits on the key functions of the post. So the main one really is to identify the key issues that are impacting local women, and then essentially do something about it, which that can take a variety of different forms, and I'll talk about that in more detail later on. And part of that is about kind of keeping an eye on local and national news and policy decisions to keep up with wider issues affecting women, as well as working with caseworkers and local organisations to try and work out what those overarching issues are. And then another side to the post as well is actually to empower women to become political change makers in their own right. So not only setting ourselves up as kind of middlemen to create change, but also to teach and empower women to take things into their own hands. So this is through things like we do parliamentary workshops to teach women about how to take action and have their voices heard. Around election times, we do things like hustings, so that women have the opportunity to ask questions to local MPs and things. We facilitate meetings with MPs, so around certain issues, and yeah, all sorts of things that just help women understand how they can directly engage and become change makers. We also, in the past, have done panels around other issues that aren't necessarily like women's issues, so to speak, but we did one around environmental activism, and we had all sorts of like female campaigners. So it's all about just kind of boosting kind of engagement within like activism and that side of things as well. And then the other side is bringing women's organisations together to increase our collective impact, and that is, something that runs through everything we do at the Women's Centre. We're very aware that we don't know everything, and we don't have access to all of the women in our community as much as we reach a variety of women. And again, that's something I'll talk a little bit about later, of how we kind of build those connections and use those to make sure that we're actually reaching communities that might otherwise not be represented in policy and influencing work. And in terms of how the role's funded, so currently it's funded through the Labyrinth Project, and prior to that it was funded by the lottery through Help Through Crisis. I think at the time we were funded for this post and for a caseworker post, and the idea was to have one person focused on one-to-one support and one person focused on like the wider overarching issues affecting the women. So that's kind of how the role was born. But since then, because of the really good work that's been happening in this post, we've decided that it's a core post for our organisation. So when there's no specific funding for it, it will continue to be funded through our reserves. So this is a bit of a look at the structure of our team, just to give you an idea of how it works, in case you wanted to kind of look at replicating it in your own organisations. This changes a lot. I've been here for 2 years, and during this time it's been in constant flux, basically, depending on funding and contracts and all that fun stuff that you all will know about working in the charity sector. But this is where it stands at the moment. And I wanted to show this really because I think it's important to say that part of the reason that this role works so well is because of what the rest of the team can support on. So as well as our policy and influencing officer, we have our marketing communications officer who looks after all of our marketing, including the website, social media, email newsletter, all that sort of stuff. So she really supports us on getting our messaging out into the world. We have our senior outreach officer, which is a new role, looking at our outreach strategy, how to reach more women and more organisations, and how we can work with them. And they manage 2 information officers, which are fixed term posts, and they're mapping out the provision of services for women. And then we have our partnerships officer, who works closely with other women's organisations. So we have a load of partner organisations who we support with a variety of things, including some funding. And we also have a women's organisation network, which we meet quarterly, and basically any organisations or projects working with women locally can come along. It's kind of like a networking thing. Sometimes we do talks and things like that, but particularly since I've been enrolled during COVID, it's just been a really good place for people to actually get together and feel a little bit less alone in some of the challenges they're facing. And that's ended up being a really good platform for groups to talk about some of the issues that women are experiencing. And you do realise that there's there's themes that just like keep cropping up again and again, and that's a really important way that we kind of find that information. And yeah, of course, the partnerships are really important to make sure that we're you know, representing like the whole spectrum of women in Nottingham, because often the women that aren't being represented in like policy work are the ones that need to be represented the most, and they're not necessarily going to be the ones that come to you. So the kind of outreach and partnership side of things is really important, just to not assume that you know, the women that are engaging with us are the only ones that need to be listened to, because that's obviously not the case at all. So now you've hopefully got a bit of an idea about like the people behind the work and the structure of how the team works. What do we actually do? That's probably what you're really here for. So it's quite difficult really to give you, I guess, a blueprint of our policy and influencing work, because basically it all really depends on the area of work that we're tackling as to how we approach it. So I've put together a little bit of a flowchart to kind of show you the basic processes that we go through. And I'll go into a little bit more detail about each of these areas and give you a few examples of kind of how we've done it in some of our previous campaigns. So it all starts with identifying some of the overarching issues affecting local women. And then we hone in on a specific issue, do further research and consultation, and then put together a policy and influencing plan using our findings. So sometimes we go down the knowledge sharing route. Obviously, we're only a small organisation and there's only one member of staff working on this, and she's part-time. So much as there are, you know, dozens of hundreds of issues that we could campaign on, we unfortunately do have to be pretty selective about what we choose to go forward with. So, and also we're not specialists on any particular topic. You know, we're not kind of childcare specialists or healthcare specialists. We're very broad, so sometimes it's not really appropriate for us to do like whole campaigns around one certain topic. So sometimes the best course of action is just presenting what we find as it is to decision makers like local MPs or councillors, or the police or the CCG or whoever's relevant to that particular topic. And sometimes, you know, that's kind of where it ends. Like we might offer to do kind of focus groups ongoing or things like that, but sometimes we just say that's not really something that we can touch for capacity reasons or for specialism reasons, and that's kind of how far we go. But if we do feel like it's something that we can really get our teeth into and make some waves on, we go down the full campaign route, doing some like awareness raising with the general public, engaging decision makers, and sometimes, depending on the topic, getting involved in kind of national conversations and wider campaigning work. So going into a bit more detail about how we actually do those things, let's start with identifying the issues. So one of the most important things that I really wanted to get across about this role is really getting organisational buy-in. Obviously, caseworkers and other staff working directly with clients are incredibly busy, and doing anything that isn't directly and obviously kind of helping individuals probably won't be top of their agenda, and kind of rightly so. So we found it really important to work out how we can gather information from caseworkers without taking up too much of their time, and also to make sure that they really understand the value of the policy and influencing work, so that they, you know, make a little bit of time for it and actually feel like their contributions are valuable. So one of the ways that we do this is our policy and influencing officer generally goes directly to caseworker team meetings every so often, so they can actually listen in and gather some information without putting any extra work on the caseworkers. And also just really setting up like a channel of communication so that the caseworkers know they can just say, ping a one-line email that says you might want to look into digital exclusion or low quality council housing or something like that. And then at least it gives the policy and influencing officer something to then go ahead and research some more. And then the kind of at the end of it, when campaigns happen and positive changes are made, it's all about kind of keeping them in the loop so they can really get a feel for the importance of their input, because really it wouldn't have happened without getting that suggestion of issues and topics from them. So so that's something that I kind of want to hammer home, like that took a while for us to build those relationships with the caseworkers. Not relationships, we're obviously colleagues that work together, but I guess like the channels of communication and the understanding that like it is really important, and that we're not trying to put extra work on them, and that like what they say actually can make a real difference on a wider scale. And another way that we gather information is what I touched on earlier about partner organisations. And yeah, this is how why it's really helpful to have these relationships, because again, creating those channels of communication where people from other organisations can come to us to let us know what their women are experiencing, and us coming back to them to let them know what we've done with that information has been kind of really valuable relationships to have. And yeah, keeping abreast of local and national news, as obviously there are constantly things happening locally and nationally that are having huge knock-on effects on women's lives. So that kind of initial period of consultation culminates in our quarterly issues paper. So this is basically a digital document that we produce, and it outlines like 4 or 5 of the issues that we've identified as being particularly prominent at that time. So that not like a massive deal of research goes into each of these individual issues at this stage. It's mainly just gathering the information that we've already had from caseworkers and partners and things like that, doing a little bit of surrounding research, and then kind of explaining the problem, presenting some case studies, and coming up with some specific recommendations about what might happen next to improve whatever situations. And then these are distributed to the general public. So we do that through social media, our email newsletter, our website, things like that. Local decision makers, so MPs, councillors, and then relevant organisations depending on the content of the paper. So that could be like our local clinical commissioning group if it's a health issue, or a specialist charity, housing association, again, very specific to the particular issue. And for us, this is the first stage of any campaign, and it's been a really, we found it a really helpful way of doing it, because just distributing this often leads to meetings with various decision makers. So, you know, we might distribute it and then an MP will come back and say, oh, we're really interested in endometriosis or whatever. And then they'll want to set up a meeting and talk about it further. Or we might get other people getting in touch. You know, often we get academics or other people from other organisations that get in touch wanting to engage. And then so the response that we get at this early stage gives us a good idea of how we might want to take it forward. It introduces us to people that might be able to help. It gives us a bit of an indication of how much buy-in we're likely to get, and so what approach we might take. So this is a really kind of, it's not a quick win because a lot of work goes into it, but it's a good way of throwing a few things out there to then kind of see what sticks. And then at that point, we can kind of get our heads together and work out where we go from there. So yeah, like I said, for some issues we identify, that's where the campaign mostly stops. Sometimes we do a little bit more research or help facilitate groups for other organisations and things like that. You know, for those, it's just a matter of sharing the knowledge that we do have with people or groups that can take it further than we can. But then for others, it's a matter of deciding whether there's a particular issue from the paper that we want to focus on. So obviously this is really dependent on our workload. I think I've been a bit trigger happy with the presentation there. It's dependent on our workload basically, and whatever else is happening at that time. Sometimes we're still working on a campaign from a previous issues paper, so we might not have a ton of time to launch a new campaign. and sometimes every single issue that came up in a paper we think is vital and has a lot of potential, and we want to do something around all of them. So it's, I guess, a matter of working, like looking at the bigger picture, thinking about how much time we've got, how much support we have, and deciding where we feel like we can make a real difference. And then once we've honed in on something, we can start to conduct some further research and do some consultation. So this, again, will vary massively for us depending on what the campaign is. And I'm aware that all this is pretty hypothetical at the moment, and I will give you some real examples of how we've done it in the next few slides, so that you can, you've got something a little bit more to latch onto. But mostly how we kind of conduct research and consultation is with focus groups and surveys. One of the things that has come up from having to work remotely because of COVID is that actually using some digital kind of techniques for gathering information, like online surveys and focus groups, can actually be great for women that aren't able to or don't feel comfortable coming to in-person things, want to submit things anonymously, that sort of thing. So that has opened up like quite a lot of opportunities, really. But of course, there are also lots of women who can't or don't want to, for whatever reason, access the tech to do it, and want to do it in person. So what we've basically realized is that a mixture of all sorts of different kind of consultation methods has been really effective, because it gives everyone a chance to input without kind of assuming like one specific approach. It does mean quite a lot of work, because you'll want to do focus groups in the daytime for people that can only make it in the daytime, and in the evening for people that work, and then the same thing online, and all that sort of thing. But it is really worth it, because it's the way that you can get the most broad kind of spectrum of input into our consultations. And all of this stuff we make sure we advertise through our partner organisations as well, and try and get input from the relationships we have with people at partner organisations, to kind of explain to them why we think it'd be really useful and really important for their women to input. And we've had some really good success with that. We have one particular group who's super engaged, and she'll just bring along to focus groups like a whole load of her women who, you know, wouldn't necessarily have found the information about the consultation or filled out an online survey, but they're totally happy to kind of come into the centre and, you know, have a slice of cake and a cup of tea, and for us just laying on a little spread and, you know, opening the floor to women, you get so much valuable information. And it's valuable for the women too, because it's therapeutic sometimes for them to talk about the issues they're experiencing. So it's kind of like a double whammy there. And yeah, also, like, you know, just general researching the issue. Often there are specialist organisations that we can contact to kind of have a chat and get a little bit more of an idea of what's already out there. You know, other organisations similar to ours across the country might have been doing similar things. So this is the kind of stage where we just really cast the net out really widely, try and gather as much information as possible, and then bring it all back to kind of work out what to do with it. And at that point, we come up with a campaign. And like I said, it's so difficult to give you a blueprint for this, because it will vary so drastically depending on what the issue is, and who we're targeting and what we're trying to do. But a few examples of what we might do at this point is we might produce a report that we can then distribute to key stakeholders. We might do something to open channels of communication between clients and decision makers. So again, trying to remove that kind of middleman phase. You know, one of the things that we're doing this for is we're doing a piece of work around women's perceptions of the police, and some people from the local police have said that they're happy to come in, and for anyone that wants to actually, you know, themselves talk to the police about things can do that, but then we've also given the opportunity for them to do that anonymously. petitions where appropriate, social media awareness raising campaigns, events or workshops. So I think the best way for me to show you how this works in practice is with a couple of examples from our recent work. So quick wins. So these are the things that maybe weren't that quick, but aren't kind of full-blown huge campaigns. We had a couple of things sort of near the beginning of the pandemic that I thought would be quite good examples to show you. So one of them was around COVID vaccination uncertainty. So this was something that we identified as being a problem, I think mostly from partner organisations. There was a lot of misinformation being spread, and quite a lot of organisations who worked a lot with non-English speaking women found that it was a particular issue because there wasn't necessarily lots of like myth busting that they could access in like their own languages. And then obviously it was creating a lot of uncertainty, and people were worried and had questions about vaccinations, for example, that they didn't really know how to get answered. So for us, that was quite a quick win, because we contacted the clinical commissioning group to see what they were doing, and they were already doing stuff, but the stuff wasn't necessarily reaching our women and our partner organisations women. So we managed to kind of filter that information down. And we also set up a women-only online vaccination information session and Q&A. So someone from the clinical commissioning group did a bit of a like presentation and Q&A, and there were women there that could translate and things like that. And that was a really quick win for us. We had some really good feedback on it, and you know, that's an example of us kind of utilising what was already there. It wasn't really a lot of work for us as an organisation, but it made quite a big difference. And then another example of that kind of quick win, and again, like obviously, you know, that didn't solve the problem of COVID vaccination uncertainty, but it certainly like helped like pockets of our communities who we knew were really worrying about it. And that's really valuable. You know, we're only a small organisation, we're only a local organisation, and while we have done campaigning work that does change bigger things in the country, sometimes these little things are just as valuable. And yeah, with digital exclusion, again, this was a massive issue in the pandemic, and certainly is not something that's going away anytime soon. But we obviously identified that there were lots of things that were happening online, or the women could only do online, that they just weren't able to do because either didn't have a device or they didn't have access to the internet. And particularly during lockdowns, when they couldn't even go to the library or, you know, McDonald's to use the free Wi-Fi, that was a huge issue for women. And when we put out the issues paper that had digital exclusion as just one of the points on it, we actually got contacted by City Fibre, who are like an internet infrastructure organisation, who essentially just wanted to give us a load of money for us to buy laptops for women. And it was, you know, quite a quick, it was, you know, that we couldn't have planned that. It was really lucky that it fell into the right hands, but it also made us think, right, how can we get future things into similar hands, you know, in future campaigns. So yeah, we managed to get a set of laptops that we could like loan out to women. We got Wi-Fi dongle things that could give people access to the internet at home. And again, you know, we didn't solve the issue of digital exclusion, but it certainly gave us some really tangible wins. And from that, in terms of, because I've spoken, I guess, about policy type stuff, but what this work is also really good for is working out what gaps you can fill within your organisation. So another thing about digital exclusion was, you know, maybe women have the equipment or, you know, have the money for the equipment, but don't have the skills or the understanding. So we put on some digital skills workshops just to like teach women how to use Zoom or, you know, do their emails and stuff like that. And that was something that we could, you know, fairly easily fulfill at the Women's Centre. You know, it's not world changing, or it didn't solve digital exclusion in our country, but it certainly helped a lot of local women. So those are some examples of quick wins and how you can kind of do smaller things without the prospect of a really big, sometimes intimidating kind of campaign. And then one example of like a bigger campaign that we've done in the last couple of years was around menopause in the workplace. So this was something that crops up again and again in our research, was that menopause was just a huge barrier to women at work. Like over half the women we spoke to considered reducing their hours or leaving their jobs completely because of the symptoms of the menopause. There's so much stigma, and this is actually, there's now a lot more kind of public discussion about this, literally even in the last few months. But when we did this a couple of years ago, there really wasn't that many people talking about it. So there was a few layers to it, really. It was women were completely underinformed about what the menopause even was. They were experiencing the menopause and had no idea that that's what was happening because there's not a lot of education around it. And they were struggling to get back, like to continue with their jobs because of the symptoms. And so there was a whole thing about kind of inflexibility of employers and all issues like within the workplace. So it was quite a multi-layered thing. And we thought, actually, this is something that we can make a bit of a difference around, because there are so many layers to it. So yeah, this is one of the examples I wanted to give you, really. So we initially launched it in an issues paper, and then we had so much feedback from women saying like, yes, this, please, let's talk about this, that we thought we really do need to go further with it. So what we did was we created a report, and we distributed that to local decision makers and all that sort of thing. We also did an awareness raising campaign on social media. So there was kind of a few layers to this. So we did some content that was actually promoting the report and kind of making the findings of the report into kind of bite-sized accessible things. So like this first one here, these are all just Instagram posts that I pulled off. We kind of made like little infographics, and then it linked through to more information on the website. There was some kind of case study type things that could really kind of hammer home what the issues were from like a personal perspective. And there were also some posts around just general menopause information, like what are the symptoms of the menopause. And we had so much feedback of people saying like, I had no idea, like and it really hammered home how important that kind of thing was. And that side of it was very easy because the information's out there if you look for it. So it's just kind of about kind of making that into something that's accessible and digestible to our women and putting it out there. And what we also did as part of this campaign was we did a few social media polls and things like that. So on Instagram, you can do polls. You can also give people the option to input a little bit of text if you want to ask them questions. So it actually ends up being an opportunity to actually work out how to continue the campaign. So I've put on here like a quote that we got, like a comment that we got on social media, where someone directly told us what would be useful as part of this campaign, which is, I didn't have a mum or a gran telling me about the menopause. I don't know where to get that information. Please, can you do a talk? And we were like, of course. And it's stuff like that where you start the ball rolling on a campaign like this, and people will tell you what they need, and the feedback that you get from that is really valuable. So we went on to do, we got an external speaker in to do a talk about the menopause, and we had a talk around actually kind of workplace specific stuff as well as just like the actual health side of things. And it's one of those things where, it didn't, again, it's not a huge national conversation or anything like that, but we got some really good feedback from it, and it made a big difference. And another one of the things that we did was an anonymous Google form where women could let us know their workplace, like they could give us their workplace's email address, and we sent out information packs to workplaces. about how they could be more accommodating to women going through menopause. So because we actually have a menopause policy at the Women's Centre, we were able to publish that on our website and have a few more resources for workplaces. And yeah, that pack, women could say, you know, my employer's a bit rubbish about menopause, can you send it to them? And we just sent it and said, we've had feedback that you might find this interesting, and sent that to them. So this is kind of an example of, I guess you can kind of see now why it's hard to be specific until you start talking about these specific campaigns, because each issue is so individual that it really, you kind of have to sit down and think, what are the layers of the issue and how can we kind of approach each one of those individually. But we found social media so useful for that because it's such a good way of getting out a lot of information to a lot of people at one time, crowdsourcing extra information. And, you know, if you get real buy-in on social media, it's really good to then be able to take that and send that to decision makers and be like, people really care about this, so you should too. But obviously you can't only do stuff online and on social media, because then you're alienating, you know, a significant chunk of of your audiences. So it's building that in with, like I say, workshops in person and focus groups in person, and, you know, putting posters up in the centre and distributing leaflets to partners who can distribute it to their women. So yeah, there's a lot that can go on when you do a kind of larger campaign like this, and you can do as much or as little as you want. And that's why I wanted to kind of show you some of the quicker wins as well as something a bit bigger like this, because there is a spectrum of it. And I think for us, one of the hardest things is dialing it back and narrowing it down, because you could do so much. But I think once you start to realize that actually you can't do everything and that you've got to be a bit specific, it gives you a little bit more focus and allows you to really kind of hone in on the things that you really can make a few more waves on. And then after the kind of campaign, one thing that I just wanted to kind of hammer home again is to make sure that everyone who contributed is updated on the progress of it. So particularly, like I said before, caseworkers and anyone who's actually taken time out of their ordinary day job to help you with it, it's really important for them to see those wins, because then they can really understand why their contribution is so valuable, and hopefully it will help them engage even more in your future campaigns. But also, you know, when you're doing surveys and things like that, you can have a final question on your form that's, you know, would you like to be kept up to date with our work on this? Obviously make sure it's GDPR compliant and all that stuff. But then you can create little mailing lists where you can keep women in the loop. We have a couple. We have one that's just anyone who's generally interested in policy work. And then, you know, if we do a specific thing, like we have a menopause one where anyone that contributed to the menopause report got to, you know, got updated on the progress of it. So yeah, that was like a real whistle stop tour. I'm aware I've talked a lot. If you want to keep an eye on what we're doing in terms of campaigning work, the best way to do it is through our social media and our website. You can sign up to our email newsletter on our website. So yeah, the details are on those slides there. And yeah, hopefully it gives you a bit of an idea of how we do the work like that at the Women's Centre, and why it's really helpful for us to have a specific member of staff that really focuses in on it, which we're incredibly lucky to have, because as you can tell, although we have plans and structures in place, the actual work itself by nature is really reactive. So to have someone who can basically be the single touch point for various issues, who has the space to really sit back and plan out campaigns and build relationships with partner organisations and stuff, is really important. So yeah, I know that was a bit of an information overload. So does anyone have any questions?
So if no one has any questions at the moment, just to let you know that you can also kind of take this away and have a think about it, see how it might apply, or how parts of this model might apply to what you're doing in your work. And you're welcome to email myself or our team at Labyrinth, and we'll pass it on to Sophie. We have a question from Emily. Can you see that, Sophie?
Yes, I'm interested in how the Notts Women's Centre have handled the LGBTQ+ policy. Is it possible to get an email address to ask some questions? Yeah, I'll pop my email address in the chat. I'm not sure exactly what you're referring to. We have a trans inclusion policy, which we're quite a vocally trans inclusive organisation, and we're happy to send out our trans inclusion policy to anyone that might want that for their, to have a look at for their organisation. I'll pop my email address in the chat.
All right, well, thank you very much, everyone. I hope you have a great rest of the day and hope to see you in our next session.